The Rivers State University Teaching Hospital and the Nigerian Cardiac Society have organized a free cardiovascular health outreach for civil servants to commemorate World Hypertension Day. Over 100 beneficiaries received blood pressure checks, ECGs, cardiac consultations and medications. The event emphasized the early detection and management of hypertension, warning that undiagnosed conditions could lead to stroke, heart failure and kidney diseases.
To us, because hypertension, as already been said, is a silent killer. Once we control hypertension, there will be less of heart failure on the wards. Once we control hypertension, there will be less of chronic kidney failure on the wards. Once we control hypertension, there will be less of stroke. Once we control hypertension, there will even be less of erectile dysfunction in the men. So all of these are all products of high blood pressure.
A lot of people are living in ignorance as to the state of their blood pressure and their general, health status. So this is more of an awareness we're creating for people to get more health conscious. This clinic runs cardiology services. We're situated within the Rivers State Secretariat complex. So it's an advantage that within this office complex, we have a healthcare facility that can manage diverse ailments, diverse conditions, and especially today as we're talking about the cardiology World Hypertension Day.
Most individuals don't even know they're hypertension in the first instance. And there are the people that die suddenly, unexpectedly sometimes, and that's why we call it a silent killer. And another worry and concern is that even those who know that are hypertensive don't actually follow up to know exactly where they belong and that they need to be on follow-up and also take their treatment and to do other lifestyle modification. It's not all about drugs. It also involves lifestyle modification and the kind of things we take in, including food like drinks like alcohol and cigarette smoking. All those are deadly things that we try to advise people not to embark on.
Beneficiaries including Rohoma Chinedu Kajek, Permanent Secretary of the Ministry of Youth and Sports Development, and Ilaye Jumbo, a civil servant, praised the organizers for the life-saving interventions.
Please come and have a checkup. I didn't know I had an issue until I just checked, and surprisingly, that's why it's called a silent killer. Like I was asking them, this truly is a silent killer. I was just fine. I didn't feel anything, and then here I am. My reading is that high, so you never can tell. Just come and do this test, and it will avert what you do not know is lurking in the dark.
Oh, it's very awesome. And medication in Nigeria, we all know how expensive it is. And when we see opportunities like this, the best you can do for yourself is to take advantage of it. And that's why I came here as early as possible. Actually, I'm supposed to be at work, but I asked myself, you have to be healthy before you can work, because your job, any administration or agency can do without the best.
Senior Registrar, Rivers State University Teaching Hospital, Dr. Rita Wakama, reinforced the need for lifestyle modifications, including reduced salt intake and regular exercise, to manage hypertension effectively.
Go about helping ourselves, number one, like I said, inactivity, you have to do exercise. Exercise at least 3 times in a week, 30 minutes. You can stretch it up to 45 minutes, 3 times a week, regularly. If you can do it every day, no problem, it's good for you. It has a way of bringing down your blood pressure. We need to go back to those days of, fresh food and fresh vegetables. A lot of vegetables with fruits, which helps us because they are known to have antioxidants, things that will help us fight a lot of diseases in our body to prevent not only hypertension, a lot of diabetes.
With hypertension affecting millions silently, experts say such initiatives are critical to reducing Nigeria's burden of cardiovascular diseases.